neurology, physiology, and anatomy, cerebral arteries, circle of Willis, and the dural venous sinuses, along with the homunculus. All right, so first off, let's start off with the homunculus. We've learned this multiple times prior, but I'm sure everyone has their own way of memorizing it. But what I normally do is that I start at the essentially center of the brain, and I go out laterally. So the located center within the brain, okay? So the area that's essentially like cut in half if you were to take a look inside the brain. Majority of that area is going to be supplied by our anterior cerebral artery, okay? And that's going to give motor and sensory function to our feet and our legs, right? So if we ever knock out the ACA or the anterior cerebral artery, you're gonna knock out that region of the brain that's opened up, the middle area when you open up the brain, and it's gonna knock out motor or sensory function to that area. Next is going to be our middle cerebral artery. The middle cerebral artery, remember, is going to cover majority of the lateral aspects of our brain. And the lateral aspects of our brain are going to cover the motor and sensory aspects of the face and of the hands and arms. So keep that in mind whenever you have a middle cerebral artery infarct, okay? And then lastly, we have the PCA, the posterior cerebral artery. That's going to supply, obviously, the primary visual cortex located in the occipital lobe. So keep that in mind when we have a PCA type of issue. Without talking about cerebral arteries, we can't miss the watershed zones. There's specific areas within the brain that are at increased risk of infarction whenever we have hypoperfusion to the brain. So if we have sustained cerebral hypoperfusion, it's going to lead to a symmetric bilateral wedge-shaped stripes of just necrosis in necrotic areas, okay? And those are going to be located in watershed zones. If they ever tell you that they have symmetric bilateral areas of necrosis or symmetric bilateral areas of damage within the brain, it's most likely not going to be due to a pathology. It's probably going to be due to sustained cerebral hypoperfusion, because usually you're not going to see a symmetric bilateral effect in the brain unless the watershed zones are affected. So I hope that makes sense to you when you take a look at the photo. Next is going to be the circle of Willis. The circle of Willis is very, very important to understanding the brain's anatomy and how blood flows through it. So I want to start at the bottom, okay? Starting at the vertebral arteries, okay? The vertebral artery is an upside down V. So that's how you remember that both of those are the vertebral arteries. And what comes off of the vertebral artery in a lateral aspect is going to be our posterior inferior cerebellar artery, okay? Or the PICA. Okay, and so that is very, very important when we talk about our brainstem, okay? Because the brainstem goes from the medulla to the pons to the midbrain. So specifically starting with the vertebral artery, since we have the vertebral artery supplying blood to our lowest portion of the brainstem, which is the medulla, anything that's going to cause a vertebral artery infarct will affect the medial portion of the medulla. And anything that leads to a PICA infarct will affect the lateral portions of the medulla, okay? And then we're going to take a step up. Whatever is above the medulla is our pons, correct? And so the pons will be supplied by the next artery that the vertebral blood flows into, and that's going to be the basilar artery, okay? So the basilar artery is going to supply the medial aspect of our pons. And then one of the offshoots of the basilar artery is going to be our AICA, or anterior inferior cerebellar artery, okay? And so that's going to supply our lateral pons, okay? This is all very important to identifying the location in which what part of the brainstem is going to be affected with certain infarcts, okay? So remember, vertebral artery has an offshoot known as PICA, and then the basilar artery has an offshoot known as AICA, or IECA, okay? And just think about it in this manner, in the anatomical manner. The vertebral artery is lower than the basilar artery, so the vertebral artery is going to be supplying the lowest aspect of our brainstem, which is the medulla, and then the basilar artery is going to supply right above the medulla, which is our pons, okay? Now, as the basilar artery keeps on flowing blood upward, it's going to shoot blood into the posterior cerebellar artery. And the posterior cerebellar artery is going to connect to our middle cerebellar artery via the posterior communicating artery, okay? And the posterior communicating artery is going to connect not only to the middle cerebellar, but it's also going to connect to the internal carotid. The difference that you can tell between the internal carotid versus the middle cerebral artery is going to be the location in which it goes off, okay? So if you see the posterior communicating, you see that circle, and then you see blood vessels going medially then you know that it's the internal carotid. If you see blood vessels leaving laterally, then you know it's the middle cerebral artery. Next, off of that is going to be our anterior cerebral artery, and then connecting the anterior cerebral arteries are going to be our anterior communicating, okay? There's going to be a lot of pathologies associated with the circle of Willis that I will get to later on as we hit each topic, but I want you to understand overall the main key players to the circle of Willis. Next is the dural venous sinuses. Overall, they want you to understand there's not much that occurs, but essentially what happens is that it helps drain both the blood and the cerebral sinus fluid, the CSF. The cerebral spinal fluid is going through the venous sinuses, okay? And any time that you have a block in the cerebral spinous or in the venous sinuses, you're going to see some type of hydrocephalus that can occur, okay? That's all for the blood flow in the neurology system.